This is the Zemar Podcast. Elite Benefits of America helps small and mid-sized companies with their health insurance programs. And now, your host, Butch Zemar.
There was a time when I was in the Navy. We were overseas. There were some things picking up in the Middle East. And we had a problem with the aircraft that had a camera, and I've talked about this on previous podcasts, where it was a forward-looking infrared camera, definitely outdated. It's completely gone. It was outdated when I was in, but they were still holding on to the final thread. Same with the F-14s, as great as they were for Top Gun, they were on the verge of extinction in the 90s, going into the 2000s. But on this FLIR pod, we had a problem that it would keep failing in the aircraft. And there was a lot of debate between us and the squadron on what was actually wrong with these pods. I personally, even to this day, think it was the wiring in the aircraft. Of course, the squadrons would never admit to that because that means more work for them. And their argument is, well, it failed. Well, it's the pod, right? And so anyhow, at one point we decided, you know what, we can't figure this out. Let's just strip the whole thing and start all over again. How would we put this back together? Is there a sequence to put it together? And when we started just stripping them down to the bare wire and then adding them, all the pieces back together, they actually started to pass. And so I'm not really 100%. I mean, obviously there was a connection issue somewhere, but not all the pods. We're talking about maybe 8 of these pods, meaning like big eggshell looking things. All 8 of them shouldn't have the same connection issue. So who knows what really transpired there. But as I'm talking through this, it also reminds me of that movie Apollo 13, which I referenced a number of times. But there's a part in there where they were trying to figure out a sequence to turn on the batteries again so they could have a safe re-entry. And but they couldn't go over a certain amperage because it would drain the batteries too fast for them to get back into orbit and obviously back to Earth in a safely manner. And so they had to put it back, and they had to recreate everything from scratch. And how do we do this so that the amps don't go up? But it's just like most projects, right? We have to get to a certain point. We can't go any further, so we kind of just back off and say, okay, let's just start off over again. Some reference this as a clean slate, and so you clean the slate, you start from scratch, you start doing your drawings, right? As I record this in May of 2025, by the time it gets published or produced and up for you guys to listen to, it's probably going to be maybe closer to June. But my whole point is that we're mid-year of 2025, and employers need to start looking at their benefit programs for January 1st, 2026. And some might think it's insane. Even my peers would say that it's insane, but the reality is it's not. I can't tell you how many times as we've grown internally at the agency that we've had to keep backing up timelines because there's not enough time. Not enough time for the employer. It's not enough time for us. We get super busy too. Got to back the timelines up. Otherwise, you can't fit everything in, including the employer. The reality is, if you're listening to this and you're over 1,000 employees, tens of thousands, you're already discussing 2026 and potentially 2027 health plans right now. And the reality is there's enough leverage there at that capacity to have a multi-year outlook. So there's, in some cases, you already have predictability and you're just kind of making final tweaks and you're getting, models ready. And at that level, there's insurance companies that would love to do the prediction model of putting things together in anticipation, and it's guaranteed business for them for those years. But if you move to, like the 100 to 1,000 employee space, right now, it's definitely, you should be picking up the ball if you haven't already and start moving with it. You need to have that review, and you need to start getting your sleeves rolled up and pushing through, because you're going to be behind the timeline if you wait longer. Then you have the 50 to 100 space, and you should play with the big boys. You should start reviewing the items now, right? You may be not rolling up your sleeves and getting dirty just yet, like the 100 to 1,000, but you should definitely be talking to your benefits advisor now and saying, okay, let's start having a series of meetings. Let's make them productive. Let's have agendas, and let's make sure that we're moving in the right progress, right? Sure, there's less urgency because of the timelines, but you could have deeper discussions on preliminary proposals right now, whether you're 50 employees or you're 50,000 or, somewhere in between. And so there's definitely discussions to be had. These are worthwhile and purposeful, especially for employers that are trying to look for a different outcome. These outcomes sometimes are going to be consistent and always the same on renewals because of the way you're doing it, the way you're purchasing it, the way the benefit brokers or benefit advisors putting these things together. And so there's a number of things that could be reviewed. And so you definitely should start working on it. So, but the 50 to 100 though, they're the most vulnerable in that kind of category. I mean, you could probably push it down to 25 employees too, because there's a lot of things that come into play related to HR and benefits that they're not ready for, right? Some of them have HR managers, most of them don't. Employers too busy trying to run their company in so many different ways, and operations to sales to expenses, the list goes on, that they don't have enough time to put this all together, right? And so it reminds me of that, the words of wisdom, and maybe it's only the people that I know that had shared this with me when I was younger. But from the age of 18, people give you passes on making mistakes and not doing what you're supposed to do, right? They minimize what, the mistakes are until you reach the age of 30. When you're 30 and you're older, right, you're held more accountable for those actions. Whether it's your friends, your workplace, your personal relationships, your spouse, so on and so forth, all of a sudden you become more accountable. But, this is like the 50 to 100 where you're starting to be held a little bit more accountable. Sure, you should have been held accountable. Like they say, well, when you're 18, you need to be held accountable. So when you're at 10 employees, you absolutely should, but it doesn't mean that it happens. And so you need to take more responsibility in some of the benefit packages and how things are being put together. So have those meetings now, especially if you're renewals in the first of the year. But, for the smaller companies, the 10 to 50 market, 10 and 50 employees, you should definitely be having a mid-year review and have it now. You don't need to wait to June. You don't need to wait to July or August. Have it now, right? Because there's going to be things that need to be discussed, especially when health insurance premiums are super painful for a company. And why wouldn't you try spending the time? Some of the brokers won't move forward on any of these meetings because it's almost summer now and they're golfing, right? And now you're interfering with some of their playtime. And maybe you have to start considering that benefits advisor and get a second opinion somewhere. But definitely start forcing them to do it. But you definitely need to get in front of advisors so you could start reviewing some of this stuff. And it could take time. So you want to buy that time, right? The board of directors, the employers, they have ideas that they have, and but the problem is some of those are preconceived ideas about the market space, the products, and we need to get through those. We need to combat that, but sometimes that takes a little bit of time, so we need to have further discussions. Definitely about strategies that are going to be put forth, 2 to 5 years in the future, and so you need to start working on some of that now. But a lot of things come down to the accountability in this world. It's called fiduciary responsibility. Employers need to have skin in the game and start doing something because lawsuits are coming. And if you're not doing what you're supposed to, an employee's going to sue you and say that there's better options out there and you didn't do anything about it. And you're going to be responsible. Now, some of the court cases, they're throwing some of the stuff out based on certain filings. But I'm telling you that if there's another option that's out there, eventually you're going to get in trouble, slapped on the wrist. And maybe you could afford to get out of it, but maybe you're not. Maybe it's going to force you to shut your doors, but put your big boy pants on and start taking responsibility of this. And why wouldn't you? If at the end of the day, all you do is save money and give your employees better health plan, then you win. And if you take the responsibility and combat it the best you can, and there's a lawsuit filed and you could prove it, you get out of the lawsuit, right? So it's a win-win no matter what. And most likely, if you're putting forth the effort, you're probably not going to be in that situation. But the issue is that these businesses make business priorities over benefit programs. And so it's this side item that nobody wants to touch. They're just going to wait to the renewal. Like, we have clients that won't meet with us unless we have numbers in front of them on their existing plan. And sometimes that's really hard. We can't get the renewal early. And I think they're blinded by this, because it's like, well, hold on here. By the time that the insurance company is willing to give out the renewal, which could be 60 days, it might be too late to start having these discussions in some of those cases. We just can't do it. There's not enough time to negotiate or try to figure out what's the best option, maybe some competitive quotes, and then try to make an executive decision and still have an open enrollment. There's just not enough time. So I think employers that wait to this is just blinded by the fact that just because you don't get the numbers, it's almost like I'm going to take my ball and go home until you have a bigger ball than I do. It's just crazy mindset. We have an issue with preconceived ideas of making any type of moves. And even just recently, we have an employer, we insure a small entity of this bigger company. The bigger company is doing something different. And this owner says that, because I presented ideas that we could save money by this is a smaller entity. So I think it was going to be like $15,000, $20,000 over a year, which is still substantial. They could move that money to somewhere else and they could use it. And so, the savings, they're saying, is too risky because they don't want to move to a self-funded plan because they're concerned about all these preconceived notions. And the problem is they're short-sighted because there's so many other things. And the reality is, my first response when I was told this is that they're taking a huge risk by having he's a serial entrepreneur. So like, you have multiple businesses and they're all taking risk, and you could be completely belly up and gone and start from scratch at any given time, depending on markets and whatnot. But you take calculated risk to evaluate that and then make sure that there's less adjustments. And same thing goes with the benefits, right? Just because you want a safe haven and forgo any future savings or better healthcare coverage, you're just short-sighted, right? And so, and you would analyze every other line on the expense sheet. You got taxes, you got rent, overhead, supplies, manufacturing, your outsourcing stuff. All those you usually will take and combat it. But all of a sudden, when it comes to benefits, all of a sudden you just get scared and it's too risky. And you won't spend the time to figure out how to calculate the risk, just like you did with taxes and rent and overhead and supplies and employees and all that other stuff. You did a calculated expense and you evaluate it on a regular basis, but all of a sudden healthcare, right out the window. It's like you just want to roll over and play dead, which some people really feel that way when it comes to this stuff, but you can't. You got to fight this thing. And I always try to use the example, if you guys ever watched the Pirates in the Caribbean, there's this one, I don't remember which one it was, but he, the Captain Sparrow is trying to go head-to-head with this Kraken. He's all alone now, and all he's got is a sword, and he just says, all right, let's do this, and he just dives at him with a sword, right? You got to do that with healthcare, right? There's probably going to be a dead end on some of this stuff, but I tell you got to go down fighting, because I tell you, if you come out on the other side on these benefit plans and you're built a better benefit package for your employees, you have better outcomes, you're saving money, you're reversing the trend, holy smokes, it'll blow up your business in a good way. And so just don't avoid it. As many of you know, I have 4 boys and they're all completely different, but I have this one, he's my third one, he's super creative. They're all creative in their own way, but this one specifically is a little creative in a lot of ways, and I'm going to go through that. But all of my boys love playing family games, and I'm thankful because my wife Julie, she does this all the time. I'm not a board game guy at all. It's probably just outside my comfort zone. I never really did it. I do play once in a while. It's just not something that I look forward to, whereas every time they're over at grandma's house, they're always looking forward to playing a board game somewhere, and I think that's awesome. My kids will play for hours. They just don't could, and especially since they're off electronics too, but they actually truly enjoy it. And even the younger guys want to play the bigger adult games with them that are probably closer even to 10 or 13 or 15-year-olds or older, just because of the complexity, and they basically put it on a grading curve, but they're teaching them how to play the game, so when they get older, it's fine. And I think that's wonderful. It's a family environment. Everything's good there, right? And so, but this one in particular, he'll go and play a game, and when it's over, he'll actually just say, I'm going to go make this better. And so he'll go off in the other room, and he'll grab the paper and cardboard and coloring material and tape and scissors and just start making his own board game. And he's done this multiple times. He'll even create and write out some of the rules, and he'll have some in his head, but if he's actually written some of them out, he'll rebuild this game that usually it's similar to one that we just played. Sometimes it'll add in some other things, just literally from the ground up. It'll be similar to the game that we played, but he'll put his own twist to it and make it just more unique. And it's obviously awesome as a parent to see this, and it's fun to see any of the kids be creative, whether it's your own or anybody else's. So if anybody listening to this does this, I think it's fantastic. And I personally haven't played any of his games. My wife has, of course. Julia shared that they're really, really fun, especially because it's his game, but they're just fun in general because he used a lot of creativity going into it and probably did make it better on some of the games he created. So with this creativity about just starting from scratch and trying to build a better game, the idea, actually, the correlation came from a video that another benefits advisor here in Chicago named Christopher had done. And I'm just summarizing. This is my takeaway from it. If you go watch it, you could probably, you'll get his words exactly. I'm not trying to quote him, but this was my interpretation as we walked away, right? And so, but he's on LinkedIn, Christopher Gordon, great guy. So I would definitely encourage you checking him out. But in one of these LinkedIn videos, it's kind of acted out in some ways, but it's just about the message to employers out there. He asked an employer, we get that you don't really like your current health plan, but if you were to create one from scratch yourself and you were funding it and you were the insurance company, how would that look and how would you put it together? And it's a very similar insurance company, but you're the one building it. And what would you want in it? How would you want it structured? What would you want to do for cost control measures and insurability as far as paying out risk claims and how they're done and handled? And a little bit of the response was, it's going to be quite scary. It's going to be higher risk, and this is completely understandable. And that's why there's insurance products for each one of these things. You could either inherit the risk or you could outsource the risk, just like anything else in our business. And that's the problem, I think, with benefits programs is they put it in this, stepchild category that they have to look at things completely different. But the reality is they have to look at it just like any other business decision-making thing in the entire company, because you're either inheriting a risk on something or you're outsourcing it or you're completely dissolving it altogether. Obviously, you're competing for employees. It's a benefit to offer. A benefit plan you're not dissolving, so that's out. So either you're going to outsource risk or inherit risk or some combination. And so, the reality is the more you outsource, the less you have control, but the more security you have, but you can't negotiate or do anything about it. So you can't take that P&L statement on the health plan and say, okay, how do we make this better, just like you would for any other expenses? So you have to get to a plan that allows you to do that. So you outsource the risk that you're not comfortable with, and you inherit the risk that you are. And the reality is part of this is taking predictable expenses out of the health insurance, out of the insurance product altogether. Because the reality is, in a business, your workers' comp isn't covering true auto insurance. Now it's going to cover car accidents. There's that higher to non-owned, but or your business insurance is not paying for your office to be cleaned or power washing to your building or whatever you want to come up with. It's just not coming out with that, because those are definitely predictable claims, but also it's not sudden and expensive unpredictable claims. And so, if you took all these predictable expenses, just like in your other expenses in the company and those fixed costs, you create a budget for it, you pick a vendor, You purchase, you may even have it on auto ship and have everything on autopilot until it needs to be reviewed again, because you already set a budget, it's fixed, you know what's expected, and that's what it is. But the reality is a lot of these health plans, they automatically include these predictable expenses. Well, guess what an insurance company does? They know what the true cost is going to be. They're going to add in their little admin fee in their profits and then charge you for it, right? For something that you already know is going to exist. And, it's kind of like taking, the office supply, ordering and getting office supplies and outsourcing to another company to control it. And big companies I could see doing this because they just don't have time, capacity, because they're focused on other and they have the capital. But why would you outsource that when you could designate a purchaser inside the company and do this? You don't have to pay the extra admin fee and profits on top of that. And so it's the same thing what you're doing with these predictable expenses is that you're prepaying those. And a lot of times back in the day, you could actually see this breakdown a little bit more. Since the Affordable Care Act, you cannot, but on self-funded and level-funded groups, you could start looking at some of this stuff because you could take those predictable expenses out and make health insurance work like it's supposed to do, like any other insurance product, which is sudden, expensive risk. But the good news is you don't have to learn health insurance and the products to make this really work. You could go to benefits advisors to help put this together. And the reality is even some of these insurance products that you don't want to inherit the risk on, they actually come out of the box with the most of the features that people look for and want, and the insurance company is willing to insure. So it's not like you're creating any of these from scratch. And if you're worried about missing things, that's where advisors come in, just like if you hire a CPA. So how do I expand in another market? How do I do this or that? And so you would hire an attorney, you would hire an accountant, you might hire a business consultant that's already done the work before. And so that's where advisors really come in. And so that's the nutshell of what you're trying to evaluate here and to build a better health plan. By using these advisors to piece all the pieces together so that you're not doing the hard work, you're just analyzing the cost, just like all the other expenses in your business. Sure, it's not as easy as creating your own board game like a kid and having the family play, but it's about creativity, and the creativity is similar. How would you like to see the health plan? What benefits would you add or subtract on the plan? How would you build the perfect benefit plan for your employees? What would make them the happiest and they brag about it? But employers and brokers are definitely past that point where they need to take more responsibility. When they need to step up and have that accountability. And this is why it's a great question is, how do you want it built, right? And what risk are you willing to take, and what should we outsource, and what can you just control overall? Just like anything else in the company, like you could take something out of a box and have a cookie cutter, and it'll work for a period of time. And as you evolve and grow your company, even your own employees will start asking how to modify certain things to make it their own, make it easy for them, right? It could be the parking lot, it could be administratively, it could be a number of things, and all of a sudden you're like, yeah, those are great ideas, let's make it better, right? So every company's a little bit different in modifying and customize it. The health insurance plan is no different than this. Sure, does size matter, the company? Yeah, unfortunately it does, right? So some of these tools can actually go down to 2 employees, but there's a higher risk there. So because they have to meet a certain checklist, but even more so the claims are an issue. But even if you're in that space, you could actually get cookie cutter shop products that come out of the box, but you could actually still customize some of the options. If anything, you're getting financial reporting that you didn't have before. You could use this as leverage, especially if you have plans to grow the company and you move into a different space where you have more options, because the bigger your company go, you have a lot more options than just the three carriers or 4 carriers that put billboards up and put radio and TV commercials up. And so there's a lot more options. Sure, they're not putting billboards up and upgrading your sports events tickets, but they're in the market space. They have a great name. They've been doing it for a long time, and they're granting you savings compared to the other options. But even though smaller companies have an inherent risk of being blown out of the market, it's not the end of the world though. So you could start off, if you're in a position where you could start saving money by moving to some of these products, And then eventually you still have a safe haven that you can move back to those more secure plans. So like under 50, it's going to be the Affordable Care Act plans. Everything's age rated, and it doesn't matter what your health conditions are. And that makes it a little bit safer. But sure, your premiums might go up, but it won't be as bad as one, not being insured because the company won't take the risk, or two, usually the increase is a little bit bigger than what the fully insured market is. But even if you're over 50, right, they do underwrite fully insured plans, but they're going to issue a premium unless you're really drastically out there. But usually they just issue a premium at a higher rate. But most likely these rates are still going to be low enough than your blown up level funded, self-funded plan. And so in a quick case study that happened recently, we have a company in Chicagoland area that's over 50 employees in a health plan. We moved them to one of these other plans where they had a lot more control. They got levers to pull, and we were able to save money. Over a 3-year period, we probably did save them almost nearly $100,000 in gross premiums in that period time frame. But now they're having some major claims and some big 6-figure ones. And so the renewal came in, and it was super high. So we went to market. We tried to see competition. We just couldn't find it. And so we went back to the fully insured markets. And sure, there's still an increase above where they're at, but it's half of what it was if they stayed where they're at. So they, in some ways, saved off the renewal. Yes, their premiums are still going to go higher, but still, we still had leverage to go to a safe haven until it balances out, and then we'll move back to the other market. And the reality is, the bigger you get, you can't go back to those other markets. You always have to stay in that space, but you have more leverage, right? There's more premium dollars, and you can carve out certain things, kind of like a safety program inside of a workplace when it comes to workers' comp. If you're building a program that has less risk involved with claims, then you're going to get rewarded with some savings. Very similar, and it's coming closer and closer to a smaller market. And so we have a lot of tools now, even if you're 15, 20, 25, 30 employees, and it's going to keep getting better because it's gaining attraction to a lot of people because they're looking for alternatives. So even though now we're near June 2025, we need to start looking at building a better plan. Build your own plan, right? So blow it up, and how would you put it together, and see how it fits inside your company. I would start with meeting with your benefits advisor, or get a second opinion, or both. And definitely, you're welcome to call us, but definitely get the second opinion if you feel like you're only getting one-sided results here. Start with what the most expensive line item inside the health plan. And so if you don't have access to any data or reporting to see what the most expensive line item is inside of that, then that's the first step, is you need to get out of those plans and get into plans where you can see that data. And then we could actually talk about predictability a little bit in the health plan. So like, for example, we could remove predictability out of the plan. Predictable expenses is what I mean. So like doctor visits is definitely the main one, right? And sure, I realize that people really like their doctor, but there's ways to actually cut this cost for a lot of the other ones. So there's a program called direct primary care. It's a broad term, and there's a whole bunch of companies out there that do that, both local or virtual for that matter. But they basically have a fixed cost to the employers. So essentially, you're taking that cost for doctor visits and moving it out of the health plan, and telling your employees, hey, you could go to this facility as much as you want, and it won't cost you a dime. So it works out so well that some of the bigger companies are actually moving a facility right next to their campus or their building, and the employees could schedule appointments throughout the day. So even though they might be going midday, but they're not taking a whole days off of work and losing that production. They're going for the doctor's appointment that you're providing for free. You build the clinic next door, and they go back to work as soon as they're done. And so it's definitely a positive thing. Sure, there's some cost with it, but I'll tell you, it'll pay dividends if you look at long term. Another thing to look at is the pharmacy benefit manager, and then who's really receiving the discounts, and I'm not talking about contract discounts. I'm talking about internal discounts and the rebates. Most of the time, the insurance company is actually receiving the perk of the any additional discounting and the rebates. Again, when you're at the retail counter, you do get a contract negotiated rate based on a contract, but I'm talking about beyond that. Sometimes drug prices go on sale and sometimes they're not. And so they get to keep all that, right? And it's true, like on a fully insured platform, just about all of them do that. A lot of other health plans, even if it's level funded or self-funded, these drug programs. In fact, your broker is possibly getting a portion of those rebates. So challenge your broker on those rebates because he or she may be making money off of that. So you have to look at it because there's going to be pharmacy benefit managers that will actually cover the most common drugs cheaper, if not for free. And then if they get a list on those data, you could get a list of most common medications and see which plans are going to cover those better. It's the same drug. It's not like it's getting anything different. And so you could have that conversation and figure out, okay, where are the rebates going? So if you build a better health plan, the rebates go back to the employer or the employee, depending on the situation, but it still goes back to who's purchasing the product. The other thing you could do is talk about the circle of excellent provider networks. There's many of them out there. Most of these have higher ratings, despite what local hospitals and facilities tout, but these have higher ratings and they cost less. Usually in the healthcare world, the higher the rating, the cost is less versus lower ratings end up costing more. It's just there's data out there to support it. You can go look it up yourself. And then you could find out how to get these into your plan. That way you could lower your costs, not only from the expense standpoint, but even your employees. There's health plans that are built out there that if you go to these facilities, because they're higher rated, so you get better outcomes medically, and then also it's a lower cost to the employer plan, that the employer actually eliminates out-of-pocket expenses for the employees if they go to them. So if you get diagnosed with something rare, you need a major surgery, and you go to one of these circles of excellence, you could actually potentially just wipe out the cost for your employees during that time frame. Now, larger companies are usually doing this. It is trickling its way down the small group. Only time will tell how soon it'll be there. When I say smaller, under 100. Over 100, you can pull this off. And then you can control more costs through a program that's called reference-based pricing. So what they do is they negotiate contracts that they pay a certain percentage above the Medicare rate. So they're fixed Medicare rates that all the providers already approve and accept, right? And we can create another podcast just to go through all this, but they limit what it's actually being paid to the provider. So since the insurance company now has a fixed cap on what the expenses are, they can control their costs and pass on savings through premiums. Now, I think the number's over 90% of all the providers, even in the Chicagoland area or major areas, even in country like big cities, they are willing to accept this level above Medicare rate, and they don't balance bill. And so this balance billing may occur, and it's a small percentage of the actual time, and it's only for that difference. So essentially, the employees are going to get the invoice for it, and all they have to do is contact an insurance company, and most of these health plans will actually just pay the balance of it because the percentage is so small, it's not going to make a major impact on the health plan. Years and years ago, when this first started coming down the pipeline, so to speak, and there was a lot of balance billing and the insurance companies weren't paying for it. But when they collected enough data that the percentages were single digits and they were low, they just started paying it. They just ask the employees to send it to the claims department to process, and they'll take care of it. So start asking the questions and start building your own health plan to get better outcomes.